Welcome to the Natural Super Kids podcast, where you will discover practical strategies to inspire you to boost the health and nutrition of your kids. I'm Jessica Donovan, a qualified naturopath specialising in kids' health, and I want to make it as easy as possible for you to raise healthy and happy kids. Let's get into it. Hello, everybody, and welcome to the Natural Super Kids podcast. It is lovely to have you listening in, and I'm really excited to bring this conversation to you today. So my name's Jessica Donovan, and today I am chatting to Melanie Van Schelven from The Face Place. Mel, as I refer to her as, I hope I pronounced her full name correctly. Mel and I connected on Instagram quite a while ago, and it's been so lovely to connect and actually have a conversation, and that is what I'm sharing with you today. So in today's conversation, we're talking all about oral health, a holistic approach to dental care. We're talking about addressing the underlying cause of dental health problems, and we dive into things like mouth breathing, enlarged tonsils and adenoids, lip and tongue ties, airway health, and so much more. So Mel is an oral health therapist at her practice, The Face Place. She works with children and their families to find the underlying causes behind dental problems like small jaws, crowded teeth, and tooth decay. Mel's background is in dental practices, providing dental treatment to children and dental hygiene services to all ages. She now works primarily online in one-on-one appointments with parents that want to get to the bottom of their children's dental health issues using a holistic approach. And I just love that she's offering such a unique service. And in our conversation, we talk more about a lot of the similarities between the dental industry and the medical industry in terms of, the practitioners, the dentists and the doctors not having enough time, because of the whole system to really dive into what might be going on underneath the symptoms that are presenting in a particular child. So I think you'll love this conversation. Make sure you check out Mel on Instagram at The Face Place. She shares some really great informative information over there, and all of her links are in the show notes if you want to check out more about what she does. Here's Mel. Hello, Mel. Welcome to the Natural Super Kids podcast.
Hey, Jess. Thanks so much for having me.
So great to be chatting with you. Can you start by telling us a little bit about yourself and what you do as an oral health therapist?
Yeah, sure. So outside of work, I suppose it's always a good place to start. I'm a married mother of one. I live in the beautiful Whitsunday region in North Queensland. As we were just chatting, doesn't change their time zone, so I'm not leaving. For work, yes, I'm an oral health therapist. So that's a term that usually trips people up. It's too many words. I'm sorry, I didn't make it. But it is a dental qualification. It initially started as a dual qualification between a dental hygienist, everyone would be very familiar with, who cleans their teeth at the dental practice, and a dental therapist, which is traditionally someone that worked in a school dental van with children. So it's those two combined made us 3 words instead of 2. And with my qualification, there is also what they call extended scope, where I can treat all ages. And I've also done things like checkups and fillings for adults. So everyone's a little bit different. When you say you're an oral health therapist, what you can do and how you've trained is actually quite individual. So that explains me a little bit more. My background is clinical dental practices between both public and private practices. And in recent years, I've pivoted to more of a holistic view of how I work with dental health. I've worked a lot with the muscles in the mouth and face and breathing and sleep, and also helping people work through the underlying causes of what's going on with their dental conditions, like crowded teeth and tooth decay.
Beautiful. Yes. Well explained. And something you probably don't know about me is I am surrounded by dental people. So my mum's just retired, but she was a dental nurse, turned into a practice manager. My best friend is an oral health therapist, and my husband's mum was a dental nurse as well. When we got together, we're like, what? Both of our mums are dental nurses.
Well, you must have both had very lovely teeth.
Yeah,
Very well
well,
brushed.
yes. It was always, brushing. Have you brushed your teeth? Okay, love it. So, and I love that you've gone down the road towards that more holistic approach. So, can you tell us more about what that means to take a holistic approach to dental care?
Well, it means looking at more than just teeth and gums, which traditional dental care can get a little bit tunnel vision like that.
Mm,
And it's not entirely wrong because we need people to be experts in things. We do need people to have like a hyper focus on certain things. We need that. But unfortunately, what often gets overlooked is the rest of the person. And we know very, very solidly it's not a holistic or natural idea. We know that the mouth is a reflection of the whole body. There is almost no condition within the body that doesn't present itself in some way in the mouth or even originate in the mouth. And unfortunately, again, in conventional care, that can get a little bit lost because we're in there just talking about, have you brushed? Have you used enough fluoride? Are you coming regularly enough to the dental practice? So
mm,
taking a holistic look at dental health means also looking at what a person's eating and how they're eating, how they're breathing and sleeping, what other medical conditions they have, any possibilities they may have around nutritional deficiency or insufficiency, and I guess also who they are as a person, which is it probably sounds even a little woo-woo there, but what's going on in their life? How do
mm.
they do things day to day? What suits them? And adapting advice we might give in a dental practice a little more individually.
I love it, and it sounds very similar to what we do as naturopaths. Looking at a person holistically rather than just looking at the particular symptom that they're presenting with. So I love that. We're very in line with our approaches. So why aren't conventional dental appointments addressing the root cause of dental health problems? I think, I guess with our children, we're told to go and get a checkup and a clean every 6 months. But when things pop up, um, what's missing from that dental approach?
I think there's two main reasons. And the first comes from our training. So when you do a dental degree or an oral health degree, like I did, it's not a big focus to talk about what underlies the gum disease or tooth decay.
Mm,
Yes, it's taught. Absolutely, you learn about it, but not in a lot of depth, which it probably sounds quite bizarre for people to hear that. But we talk a lot about sugar, a little bit about carbs. We talk a lot about bacteria and ways to kill them. We talk a lot about brushing and flossing. We don't go much further into systemic conditions and the toll that they can take. We don't go a lot further into nutrition, sleep, or breathing. There's a lot of time spent in these degrees on clinical work, getting your manual hand skills up to scratch, which is, again, not a bad thing. You want the person that graduates from their degree to be safe and competent when they're doing fillings and the sharp things in your mouth. That's fantastic. But it's not really built in to spend a lot of time going through why the person is there for a filling in the first place. I think that's getting a little bit better, but that leads to kind of the second problem is that's preparing you for the way the industry is set up. Unfortunately, like all healthcare, dental is a business. And I'm going to sound like a broken record here. I'm not saying that's necessarily a bad thing because, of course, the people that work there need to be paid. But because it's a business, it runs on a time per money basis. So you've got item codes and charging amounts, and everything is built so that each chair in the dental practice earns a certain amount of money per hour. And that doesn't leave a lot of time for sitting down, having a conversation, going through a medical history in detail, and talking through education and strategies and really in-depth, get to the root cause approach. We did do like a little bit of that at uni, but when you go out to the world, you're just not going to have time for that. Depending on where you work, you may have anywhere from 20 minutes to 45 minutes to do like a scale and clean appointment checkup. And that includes your setup and pack up and writing your notes and being friendly and sociable and actually doing the manual task. So combining those two things, the education doesn't focus on root cause as much as it should, and the business model doesn't allow for it, then we end up with this drill and fill cycle, or drill, fill, and bill cycle, as you might call it. There are some dental practices out there in the world that have changed. There are a little bit different, but they are few and far between, especially in Australia.
Yeah, so true. Like that point about it being a business. And I know from knowing people in the industry, like sometimes even there's commissions that are paid to, so there's that monetary incentive for people to be quick, and so that is another reason that they're not going to have time to, talk about nutrition or whatever, because they have to get the next person in.
Yeah. And if there is time, it's like 5 minutes, and
It's
that's
not
usually
enough
not really
time.
enough when we're maybe coming from a family that is drinking a lot of juice and soft drink and eating a lot of processed carbs. To kind of jump in and talk about whole food diet in 5 minutes, that's really not enough. And I should also point out that the public system is the same, that it does also operate as a business. Even though it's government funded, you do still work to time and to codes and to funding.
Yes. And, like you said, it's not always a bad thing. But I think for parents, you need to keep this in mind when, certain advice is given. Yeah. And it's such a good point, like 5 minutes to maybe say, well, you need to cut down the sugar and cut down the juices. But that's not really helpful advice, is it, to a parent who's like, that's their norm. So yeah. Okay. So we see a lot, we talk a lot about mouth breathing here at Natural Super Kids. It's a common thing that we pick up in kids when it comes to, sleep issues and all sorts of other things like enlarged tonsils and adenoids, which we're going to get into as well. So as an oral health therapist, can you tell us more about mouth breathing, why it's important to get assessed if we notice that our child is mouth breathing?
Yes, I'm very interested in mouth breathing. Anyone that has met me before this podcast will know that mouth breathing and the mouth and our general health are so closely linked. So we're supposed to breathe through our noses. Regular listeners to your podcast will probably know that. But so when we don't, we have a cascade of things that can go wrong. Anywhere from increasing our risk of tooth decay and gum disease because we've dried the mouth and altered the oral pH and then altered the oral microbiome, just set up a perfect pressure cooker for tooth decay and gum disease. But we're also more likely to have small crowded mouths because we're not using our muscle function in the way that we should. We're not resting our tongue against the roof of our mouth. We're not swallowing correctly. We're not using our big chewing muscles to support the growth of our jaw. And the mouth is the base of our airway. The palate is the floor of the nose. So now we've just made ourselves a smaller space in our nasal airway. So whichever one came first, whether we had a blockage in our nose which made us mouth breathe, or we had some sort of dysfunction that caused us to mouth breathe, we've then made our nasal airway smaller. So we've made a nice little cycle there where it's going to be hard to breathe through our nose, and we're going to keep mouth breathing. So we're going to keep using our muscles wrong, growing our face sort of suboptimally, increasing our risk for tooth decay and gum disease. And that has a cascade effect through the rest of our body that's going to disrupt our sleep, our nervous system, our digestion, our posture. You almost can't find a thing in your body that doesn't potentially go wrong. Hormone production, lymphatic drainage, the works, if you're not breathing properly and then therefore not sleeping properly. And it just keeps feeding itself if it's not intercepted.
Yes. And so we're talking about, chronic mouth breathing, like, when kids are sick, for example, and they've got congestion. I mean, I'm sure we've all had that experience where it's like, oh, I just can't breathe through my nose. I'm breathing through my mouth. But when that continues for long periods of time is where the problems can lie, right?
Yeah, we have an oral airway. We need it. It's there for a reason. It's our backup or our emergency, because no matter how healthy you are, you probably are going to encounter a respiratory illness at some point. You need another option. Otherwise, we'd be in a world of trouble.
Yes.
So yes, mouth breathing under exertion and during illness, cool. You can teach yourself to nose breathe, in under exertion, like running and speaking and things like that is a little bit more of an advanced skill. Not as many people do it. It is possible. But for the most part, nose breathing is where we should be.
Yes. Yeah. So if anyone listening, if you're noticing your child is breathing through their mouth consistently, and it's always a good idea to go and check when they're sleeping as well, because that's the primary time, isn't it, when we can really notice it. That needs to be looked at and assessed. And I think you've gone through really thoroughly all the things that can link to. It's a bit like when I talk about the gut microbiome and how it impacts everything, like the mouth breathing impacts everything. And as you said, including that oral microbiome. So
yeah, and the mouth seeds the gut. So if we've
exactly.
disrupted that, then that's our next connection there.
Yeah, it's all connected, which I love. And so something that we talk about regularly, which I know is again a passion of yours, is enlarged tonsils and adenoids. So common in kids, and when this occurs in kids, they go and see a doctor or a specialist, and generally what's recommended is surgery to remove the tonsils and adenoids. And I know any content that we put out on enlarged tonsils and adenoids on the podcast, on Instagram, goes crazy, and that, like, we just can see how much of a common issue it is in families. So we've got our own take on this, and I'll link to some episodes that we've talked about in the past on the podcast about enlarged tonsils and adenoids. But tell us a bit more about the relationship between large tonsils and adenoids and dental development and mouth breathing.
Yeah, so it's definitely multifactorial, because I love your
Mm.
guys' approach where we're looking at nutrition and microbiome and like immune function. Like there's a really big picture there.
Yes.
From the dental development and oral function point of view, we're thinking about the space that those tissues are in, because of course they're normal. Tonsils and adenoids are normal, and they go through normal like growth spurts. They are supposed to enlarge at certain ages and then kind of back down a little bit. That's all normal and is supposed to happen. When we have a space that's a little bit too small for them to grow into, it can make an otherwise normal sized tissue be a bit too big for the space that
For
it's
the
in, which
space,
can start
yes.
rolling this issue of us mouth breathing
Mm.
if it wasn't already there for some other reason, like allergies or something like that. Um, Mouth breathing isn't, it's a little bit contentious to say mouth breathing causes those tissues to be too large. I think that the link is a little wider than that. It's not direct mouth breathing to large tonsils. It's a bit more of a cascade. But when we have this small, narrow palate and this small lower jaw, we make the airway space small. So these tissues grow to their normal size as they were going to anyway, and they grow into a space that is too small. And then we're mouth breathing to deal with that, because now we've got a blocked airway, either during the day or during the night or both. And now they're going to be inflamed and dried out from the mouth breathing, and the sleep's not great. So the immune system and the digestion and the nutrition aren't great. So we just kind of feed the beast, if you will.
Mm.
So those small structures can literally happen from birth if we've had something unfortunate, like a tongue tie has been there and not grown the face in utero. They can happen if feeding wasn't optimal, which of course can be a follow-on from tongue tie. But many things can interfere with that. If we're not chewing and swallowing as we should to support the growth of the mouth and face, then we're going to keep on that process of the mouth not growing big enough. And then it's like a risk factor for those tonsils and adenoids to be enlarged. And I'm yet to come across a child that has large tonsils and adenoids that doesn't have some sort of suboptimal growth and function of their mouth and face, either just a niggling thing we need to sort out, or quite an extreme concern.
Yes. And yeah, I love everything that you said there. And as you said, it is a multifactorial approach. Like when we're working with kids with enlarged tonsils and adenoids, we're regularly, referring them to get oral function assessed, because it's such an important part of the overall picture. And if we can, for some kids, surgery removing tonsils and adenoids can be positively life-changing. It can really improve sleep and that sort of thing. But if we can manage to, get on top of that without surgery, then that's always a good thing.
Yeah, there are certainly people within the dental sleep medicine community that really want to work on that growth first, that's their avenue for trying to avoid surgery. But I know we've talked in the past before, Jess, that we've got to look at each person at, you know, who they are and where they are. Like if we've got a child with significant obstructive sleep apnea, we're not going to muck around trying to, you know, do fun, like whatever we can with something else. We've got to kind of jump in and help them out pretty quickly. If it's a little more of a low level thing, then maybe we can try some other things first. And from that dental perspective, they do things like palate expanders, orofacial myofunctional therapy, which basically restores the function in the face to do what it should be doing, chewing as much as it should, swallowing as much as it should, close lips, breathe through the nose. But yeah, I lost my train of thought a little bit there. Sorry for what you were saying. Trying to avoid surgery. Sometimes we can, sometimes we can't. Sometimes I think in all circumstances, really, it should be both. I think we always need to look at what's happened around this kind of medical picture.
Yes.
But yeah, where we can, we try.
Such a good point. Even if the surgery goes ahead, like the tonsillectomy or whatever surgery goes ahead, it's still important to look at like the overall picture and address, you know, some of those things that have led to the problem in the first place, for sure. Now, this wasn't on our agenda to talk about, but I'd love to quickly chat to you because you mentioned it, tongue ties and lip ties. What are your what I don't know, like I don't have any specific question, but your general approach to tongue and lip ties.
Very individual again. It really depends on at what point the person is presenting to be assessed and what's going on at that time. For babies, like if we're right at the coal face of it, because these things are developed in utero, so these tissues are developed in the first trimester. Baby has a face, so if they have a tongue tie, lip tie, then it's already there before you're even 12 weeks. So that means that from within pregnancy, they haven't practiced swallowing correctly as they're swallowing their amniotic fluid. So when they come out, they're not prepped as they could be for breastfeeding, and their structures are going to be a real problem for breastfeeding. Feeding a baby with a tongue tie and a high palate can be an absolute nightmare. So in babies, we're always looking at what's happening. For everyone, we're looking at what's happening right now. So in babies, that's going to be breastfeeding. That's their primary thing. And there's a team approach is needed no matter who you are and where you are. We need to make sure, especially with our babies, that we aren't just looking at like a musculoskeletal or fascial tension from pregnancy and birth, because that can be where ties are misdiagnosed. We need to prepare them and rehab them from any surgeries if those are necessary. Just kind of having someone walk in and snipping a little bit that they can see in the hospital and saying, catch you later, that is not thorough diagnosis or treatment. So that probably sounds a little bit alarming to some people that have had that done. But yeah, it's much bigger than that. It needs more time than that, and it should always involve more than one practitioner.
Yes, coming back to that holistic picture, you know, and looking at the whole picture. Yeah, and this is where we see where we come across, you know, tongue and lip ties being an issue with breastfeeding particularly, which can be just really like very difficult to navigate for mums. So yeah, thank you for talking a little bit about that. So as
we're going for another hour,
yeah,
so
maybe we'll have to get you back on maybe to talk specifically about ties. So as a dental practitioner, what is your role when it comes to airway health?
Yeah, so in Australia, we're a little bit slow on this, actually. The American Dental Association has a pretty strong position about the fact that dental practitioners should be involved in airway screening, because we know the relationship between how we breathe and sleep is so intimately connected with our mouth. We're the practitioners who are there hanging out in the mouth all the time. So we really should be the ones who are screening for these sleep disorders, because we're going to see the small crowded mouths, the small jaws, the high palates, the dry lips, the gum disease, tooth decay. Like we can see tonsils if they're enlarged. Like we're right there, and we're seeing people regularly. Adding to that is a bit of a screening for how they're sleeping and breathing. Like, are they restless? Are they wetting the bed? Are they snoring? So the role of the dental practitioner is more or less that first screening process. And do we need referrals? And the traditional referral in these circumstances is either GP or ear, nose and throat referral. My approach is a little broader than that. Yes. of course, we want to involve our medical friends, but I also want to look a little further into that, which usually does involve someone like a naturopath, nutritionist, or dietitian, and sometimes a bodywork provider. And then the orofacial myofunctional, so that's the muscle function in the mouth and face, which is a bit like physio for the face. So I guess there's kind of a traditional and a holistic dental role. One is the kind of medical referrals, identifying and moving people on, and the other is really getting a broad look at what's happening and why.
Yes. Love it. Thank you for explaining that to us. And you offer online dental consultations. So how does that work?
Yeah, so I have pivoted a little bit recently. I have been doing therapy online for a while, as many people will probably relate to. The juggle with being a mum and working has been interesting. So being able to work with kids in, outside school time with limited work time has been a bit tricky with the therapy. So I still have my current therapy patients, but just not taking on new ones. I'm offering dental consultations now, and that works by a very thorough intake form, which I still managed to have more questions to ask afterwards. I actually had someone say to me the other day, no one's ever asked about all of this at once, like their whole health picture, which was, I thought, yeah, that's a problem, isn't it? But yeah, an intake, you send in some photos and videos so I can obviously actually see your child, and we go through sort of everything that's led to the point where you're at. Either it's they've had a mouthful of fillings, or you've been told they've got to have some teeth out because they're crowded, and we work out why that's happened. And then I can refer you to other people if necessary, and put in some strategies in place in your household to prevent that from getting worse or to move on from now. I offer that time that the dental practice doesn't have.
Yes, I love it. That's amazing. So we will make sure we link to all of your website so people can check you out. And also you share such great info on Instagram as well. So we'll make sure we link to your Instagram. What's your Instagram handle?
At @thefaceplace_OHT.
Yeah. I find if you just search the face place, it comes up. But I just always find your what you share on Instagram really insightful, really interesting. And you have your own podcast as well. Hey, do you want to tell us about that?
Yes, I have a Face Place podcast, which has been dormant for a little while, but I've just recorded some new episodes, including yourself, of course. We have a great one coming out about tonsils and adenoids of a naturopathic approach. And I have a few more that are in line to be edited as well. They'll be coming out by the end of the year.
Amazing. Thank you so much. It's been, we've connected on Instagram, but it's been good to actually connect over Zoom and learn more about what you do. Before we finish up, is there anything else you want to share with the audience?
I think probably just a message to parents. I have spoken to a lot of parents over the years that feel like there must have been some other reason for their child's, usually it's tooth decay related, that they've been kind of given pretty blanket advice to use some stronger fluoride and to stop having so much junk. And I speak to a lot of parents who feel like they don't do that anyway. Like they do brush their teeth. They do have a pretty good diet. They keep a check on it. They're not eating lollies all the time. And they've come to me pretty frustrated. Like, I feel like I'm being blamed for this. But my child just keeps getting holes every time I turn up to the dental appointment. So for those parents, I would really like to just say, yes, there is a reason, and it's not the fluoride. So if you want to chat about that, then I am here.
I love that. Yes. Like oral health is so much more than sugar and fluoride. Which is what we're sort of led to believe. So yeah, if anyone would like that time to talk through their children's oral health, then reach out to Mel. And as I said, we'll pop all your details in the show notes. Thanks so much for joining me. We'll have to get you back for a conversation on fluoride and tongue and lip ties.
Yes, please.
Bye, Mel.
Thank you.
Thank you so much for joining me on the podcast today. Head on over to our website, naturalsuperkids.com, for the show notes for this episode, as well as a whole heap of inspiration to help you raise healthy and happy kids. I'll see you next week.